Com. But keeping this in mind, the medical community now issuing a stark warning about Pfizer's COVID-19 pill. You remember that? Researchers now say one of the two drugs in the antiviral cocktail could cause severe or life-threatening interactions with widely used medications, those including blood thinners and some antidepressants. The warning comes just after U.S. health regulators approved the company's new COVID treatment called Paxlovid. That was last week. Joining us now to discuss is cardiologist and author of this book, What Your Doctor Won't or Can't Tell You, Dr. EvanLevine. Doctor, good to see you, and thanks so much for coming on. Obviously, this is new information. Good morning to you. We've seen these pills come down the track. We've been watching this. Now we're seeing this warning. If you take these antidepressants or blood-thinning medications and you also take this, there could be side effects. What have you seen or read?
Well, Paxlovid is really two medications. One is the active protease inhibitor, and the other one is an old medication, ritonavir. It's been used with HIV. It's 20 years old. It doesn't work well, so pharma decided, well, let's put it in with the other pills and we'll confuse the body, and the body will want to metabolize this ritonavir. It's called the CYP3A450 pathway that metabolizes these things. So just like it confuses the body to metabolize the active ingredient with Paxlovid, it also confuses the body to metabolize other medications you may be on, whether it's antidepressants or statins for your cholesterol, and the most important one, probably the antiarrhythmics. So your doctor must be aware of this, and I'm hopeful that the medical record systems that we have will alert doctors, will red flag this when a doctor prescribes this medication.
So not everyone would be a candidate, and this would be something that you would hope your doctor would stay on top of. Is that what I'm gathering from you?
Not only your doctor, but also your pharmacist. And the electronic medical records today, they have warnings. So when your doctor prescribes something in the electronic medical record, it should flag it. Now, this is a brand new medication, so let's hope these EMR records are able to do that. But yes, your doctor and the pharmacist should be aware that there may be contraindications if you're on certain medications. Yes.
I want to ask you about the Omicron variant, and it's got a lot of people talking, obviously, because it's affecting our community and really our country right now as a whole. We've seen recently thousands of flights being canceled from sick outs, people calling out. We've seen this affect how we're going to celebrate the holidays. And now we're talking about what determines fully vaccinated. It wasn't but just a few months ago where you have 2 shots. If you're inoculated, you're fully vaccinated. But now among health officials and those at the top, you see on the shows, the cable news networks, and even some government officials saying that possibility of adding a booster shot into there to call yourself fully vaccinated may be the future. Do you see that being the case?
Well, what we're seeing here is that this vaccine, which is a relatively simple vaccine, which just targets that spike protein, is being outsmarted by all these variants. So what I'm seeing and what other physicians are seeing is that they really don't protect you as well as we would like, as far as the immunization, preventing you from getting that infection, but it prevents you from getting very ill. I took the booster, but I frankly, just like you said, I'm not so hopeful that I will not contract the virus. But I am very hopeful because I took the inoculation and the booster that it is far less likely that I'll end up in the hospital. Getting the infection, I wouldn't be surprised if we all are infected at some point in time.
Let me ask
regardless.
Let me ask you about this too before we go, because there are other effects when you take these major steps. When you think about kids and keeping them out of the classroom, this is a very contentious point. The Surgeon General issues now a warning about kids and the pandemic. Here's that.
I'm so concerned about our children because there is an epidemic, if you will, of mental health challenges that they've been facing. We've seen certainly that many children have lost loved ones during this pandemic. 140,000 kids lost a caregiver. We know that their lives have been turned upside down. They haven't been able to see friends as often as they would. And that's taken a toll. It's why we've seen anxiety and depression rates go up among kids.
A final question for you, Doctor. Are we too hyper-focused on stopping COVID-19, negating all the other effects that this could possibly be having on our children that are still have yet to live their lives? This is the foundational period that they're going on. They're seeing, masks and inoculation and being shamed if they're not inoculated in their classrooms, parents dealing with it as well. And he even cited anxiety and depression going up.
I agree 100% with you. You see a number of deaths, and that's easy for us to comprehend. But it's harder for us to comprehend all those kids out there. And many of us have children. I have children, and they all complain, Dad, when is my life going to get back to normal? When am I going to be able to play with my friends, not worry about getting COVID or giving it to grandma or going to school and not wearing a mask? I agree 100% with you. Unfortunately, we're really not spending a lot of time on this because it's not such a hard endpoint that we can scare the public by quoting the amount of deaths and hospitalizations. But absolutely, I am very concerned about our children and the effects, not only now, but 10 or 20 years later as they develop their minds and brains. And it's very troublesome and something that we need to pay more attention to.
Yeah, many parents watching right now agree with you. 71%, I believe, according to the CDC, have at least one shot. 61% have been fully vaccinated at this point. When are you going to pump the brakes and look around and say, hey, there are other issues that we need to focus on, and that is our children? Dr. EvanLevine, good to see you. Thank you for your time.
Thank you.